we're going to the 70th annual conference of the New South Wales Nurses and Midwives Association.
It is my first time as a delegate at the conference and I'm excited. Looking forward to it.
Networking, catching up with all of our friends from other places.
It gets us going for, to take stuff back to our branches.
Getting to meet other people and finding out more about what's happening in their aged care. Ted's first conference. So Ted's here to fight the ratio battle.
Just learning the processes. I'm new to the union movement, so it's a big learning curve for me.
Days like today where you increase your level of knowledge, participate in those discussions are critical.
All of us need to focus on how we use antibiotics and think every time we're about to use them, say, do we really need them? What's the gain? And is there a loss?
The nursing profession must transform the way health services, and I've added, and policies are organised.
Alessandro's information was awesome. What he did was really good.
I just thought his way he presented his talk was very good, got his message across really well.
You know where the health of this community needs you to run, and you're fully competent to move in those directions. No one can afford to ignore your potential to change things for the better, and this potential couldn't be more so than for NCDs.
Almost every day now you pick up the newspaper or watch the news and you hear these dire messages of an unsustainable healthcare system.
And we're talking about the impact of rationing of care upon nurses' capacity to deliver all the care that they're required to deliver.
The longevity revolution is the most interesting and challenging aspect of life in this century. As nurses and midwives, you all make a huge contribution to Australian life.
Sometimes it's the very people no one imagines anything of that do things no one can imagine.
And I loved it. Rosie Batty was just amazing. She's such an inspirational person.
Rosie's the best one. She was really good.
Yeah, Rosie Batty was amazing.
If you want to make a difference, if you want to help support victims and their children, please join the campaign. As you know the power of a collective force, we can make a huge bloody difference.
We do need to step up because assisting victims in their workplace is something that we can do.
We've had one of our co-workers a number of years ago killed in a domestic violence situation, and it really needs to be brought to the forefront of everybody's attention.
This year's 70th annual conference is an exciting milestone. There have been many changes in nursing and midwifery over the past 70 years, both from an industrial perspective and socially. But one thing that hasn't changed is the need for strong representative voices of nurses and midwives.
We all need to keep working together with our common goals and ensure the growth of this union. For without our members, we have nothing. The industrial climate we operate in continues to be a challenge, but despite the neoliberal ideological views espoused by our current state and federal governments to destroy unions, we continue to fight the good fight.
The landscape in which we work, the principles under which we operate, and the outlook for the health and ageing sector is rapidly changing. As a result, we must change too, evolve or be left behind, and that is not something we are prepared to let happen.
So what do we do? There is no other way but to do things differently. We have to get their attention, but before we do that, we need to build our strength.
What are you looking forward to today?
Prig Howard, of course.
Looking forward to hearing from the Assistant Minister for Health this year to hear if the government's willing to have any negotiations in reward and improved ratios.
Key to the success of any strategy that New South Wales Health implements is the role that nurses and midwives play in the work you do every day at the front line. Nurses, as we acknowledge, remain one of the most trusted, most ethical and honest of the professions.
At the moment, on the ground, in the real world, we fight tooth and nail for every hour of nursing. But when I'm on the floor, I'm having to fight management just to get another nurse. So will your government support our nurse-to-patient ratio campaign now, since we're so into helping nurses?
Thank you.
Thank you. So I think there's no doubt, but obviously what we are concerned about, particularly in regional areas where The level of complexity of care and patient, for that matter, is lower because of the classification of those hospitals. Well, I'm sorry, I've got a base hospital in my town, and it's quite different to a tertiary hospital in metropolitan Sydney. So we recognise the importance of flexibility for management in being able to direct nurses where they are most needed. That remains the position of the government, and I take your point, but I think we have to agree to disagree.
My question is this: Minister, what makes your life and your safety so much more important than ours?
If your real point is that you believe that we need more security services in hospital, that is a question I know for the ministry, and I know it's one that they review constantly.
You heard the passion amongst our members about our continued campaign for nurse-to-patient ratios. Delivered via nursing hours per patient day, we continue to try to go to the table at bargaining time, and we are completely stymied by your government's wages policy. And I hope that when you're sitting in Cabinet, that at some point in the future your government is actually going to say it's time to start talking to our public sector workers around productivity, around the things that matter in their workplaces, and not simply keep saying you've got what you've got and that's it and there'll be a 2.5. It's just not working, Minister.
Despite all of the doom and gloom from the Abbott government designed to justify its attempts to destroy Medicare and to end universal access to healthcare, the facts are health spending in Australia is around the average of other developed nations.
Americanise your health system today. I'm sorry, Mr. Economy. It says here your private health insurance doesn't cover an anesthesia. That's okay. The procedure will be over before you know it. There, you'll be as good as new.
We are gearing up for the dinner.
That's always entertaining. I have an outfit, looking forward to it.
There'll be sparkles.
Yeah, it's always a good conference. We always get a lot out of it.
And I thought it was quite amazing how well organised it is.
I'm here to tell you we are the largest union in this country.
Nurses and midwives have had to fight for improvements in education, staffing conditions, and ultimately, of course, the safety of our patients. And we've won many times, but only through strong collective action. And today's no different. Unfortunately, regardless of what governments say, we need to fight to secure improvements in patient care and advance our professions.